Do you have a small chin and are you thinking about having a chin augmentation? If you are, you could be facing a dilemma of whether to go for a chin augmentation with silicone implant or having fillers injected. I am Dr. Ashish Davalbhakta. I am the director at Aesthetics Medispa and Advanced Aesthetics in Pune and lead aesthetic plastic surgeon at My Aesthetic Plus in MGM Medical College, Navi Mumbai. In this video, I am going to make it simple for you. Chin augmentation with the silicone implant is a procedure where we either put a silicone implant or it could be even a porous polypropylene implant through either an incision taken here or from inside the mouth. You place it flush against the chin bone and you fix it in there, and it gives you a permanent augmentation, and it's a dramatic change. So it's a very powerful operation. It improves your profile, can improve your vertical height of your chin, and depending upon the size of the implant that you put. On the other hand, a filler is injected. So you use hyaluronic acid with a high G prime preferably, and you inject it just over the periosteum of the bone. Periosteum is the layer just adjacent to the bone, and it helps in lifting the muscles or the fat pads that are here and gives you a projection. Depending upon where you place, of course you can bring it forward, you can push it down, and it can do almost the same work that an implant can do, but you would need more syringes. The cost of a filler would depend upon the syringes that you use, and the number of syringes obviously you use, the cost goes up. On the other hand, with a silicone or a polypropylene implant, the cost is fairly same, so it doesn't vary. You would have kind of a permanent improvement with an implant, but with a filler the improvement will last only till the filler survives, and the life of the filler would depend upon the type of filler you use, can extend anywhere between 1 year to 1.5 years. After that, it's going to get absorbed. There was a hype about permanent fillers as well, but they all have had problems and complications like granulomas or extrusions, and they went into disrepute and are no more advocated. You should consult consultants like us who can guide you and advise you on what is the right procedure to do. If you are unsure of whether you would like to have or how much augmentation you should have, go in for a filler, because a synthetic filler is a quick outpatient procedure. It has less downtime, like maybe a swelling for maybe a week to 2 weeks, and then it settles down to an improvement that maybe you are happy with. If you're not, you can go in for another syringe filler after that, and tide your time maybe till a year when it's getting absorbed. Once it's absorbed, then you can come in for a silicone implant, which is more permanent. So if you're unsure of whether you would like the way you would look if you had your chin augmented, then a filler is better, because silicone implant or polypropylene implantation is a surgical procedure which has a more downtime with more swelling, and it takes at least 3 to 6 weeks to settle and for you to start liking the result. So that kind of difference is there, and if you want to understand whether which procedure is good for you, we do use morphing technology to see how you would look with your chin augmented, and we are fairly good at delivering a result that we show. Although there are no guarantees or warranties, these are only educational tools. But do come around, book an appointment, come and see us. We will be happy to help you. If you've liked this video, click the like button, share it with friends who are interested in chin augmentation. If you wish to learn more, then do subscribe. We do keep coming out with more educational videos on a regular basis, and we'll be happy to help you.